Veterinary medicine is a messy business, both physically and emotionally. Vetsplaining is one veterinarian's attempt to explain and understand her own profession a little better. Join Dr. Lisa McFaddin as she delves deep into the medical and business aspects of veterinary medicine. Thanksgiving is just 2 days away, and with all that yummy food coming, I thought it made sense if we talked about pancreatitis in both cats and dogs. And just to warn you, both myself and my son have a little bit of a cold, so if I sound a little strange and or you hear a child periodically screaming in the background, I apologize, but there's not a lot you can do when your kid doesn't feel well. Dad is trying his hardest to wrangle him, so we'll see how well this works. So pancreatitis is an inflammation of the pancreas, and just kind of a trade secret in medicine as a general rule, anything ending in itis, I-T-I-S, stands for inflammation. So your pancreas is an organ that lives just below your stomach, and it's kind of nestled against the stomach, and it has two primary functions. It secretes insulin and glucagon, which are both used for blood sugar regulation. That noise was actually my dog, so we got a lot of potential interruptions today. So the insulin and glucagon secretory portions are called the endocrine function of the pancreas, and they help regulate blood sugar. And then there's what's called an exocrine portion of the pancreas, which is primarily digestive enzymes. And these enzymes are held in these little protective capsules inside of the pancreas, and those are called zymogens. And the purpose of the enzymes is to help digest food. In particular, it helps with starches and some fats. And if the pancreas gets inflamed, those zymogens or protective capsules can break down, and so those enzymes, which are supposed to digest things, can actually start digesting the pancreas itself and causing pretty severe irritation and inflammation. And there's a lot of kind of steps that the body has to try and prevent that self-eating, if you will, which is literally what it is when the enzymes start to irritate the pancreas. And those include, there's factors within the pancreas and factors within the blood that help decrease the chance that those enzymes will come out of those little protective capsules inappropriately. One of the factors that's circulating in the bloodstream is something called alpha macroglobulins, which we'll talk about a little bit later. And within the pancreas, the primary circulating factors are alpha antitrypsin. And again, the function of those is to prevent those enzymes from being able to digest the pancreas itself. Now, the pancreas has to be able to, when those enzymes are ready to work, has to be able to get those enzymes from the pancreas into the small intestine. And there's ducts that go from the pancreas into the small intestine, in particular, the first portion of the small intestine called the duodenum. And in cats, what's called the major duodenal papilla, which a papilla is just like a little bump, basically a little opening or pore. The major duodenal papilla actually has both the common bile duct, so the tube that goes from your gallbladder, and the pancreatic duct are kind of fused together. In dogs, they usually are not completely fused. They do have some communication, but they have like a major and a minor papilla usually, and so the way that the pancreatic enzymes enter the small intestine is slightly different. So what's supposed to happen is those zymogens leave the pancreas, go into the small intestine, and then the small intestine has enzymes that cause those zymogens to open up and release the enzymes, and that's when they're supposed to work. And one of the ways we think that pancreatitis can occur, and we see this more in dogs than in cats, is you can get migration of that bacteria from the small intestine back up into the pancreas. So if that major duodenal papilla allows those enzymes or bacteria from the small intestine to creep back up, it can cause an infection in the pancreas, or in the case of those enzymes that are supposed to activate the zymogens, it can cause those pancreatic enzymes to break down and to start actually eating or nom-nomming on the pancreas itself. So that's one way that we think that pancreatitis can occur. And because cats have that connection between the common bile duct, right, so the tube that goes from the small intestine to the gallbladder, and the tube that goes from the small intestine to the pancreas, they can get this syndrome called triaditis, which really anytime we can name something fancy like triaditis, I think it's kind of cool. But that's basically a scenario where there's inflammation in the small intestine, often inflammatory bowel disease, or it could just be what's called enteritis, or inflammation in the small intestine, inflammation in the pancreas, or pancreatitis, and then inflammation of the liver itself, or hepatitis. And that's the triaditis. So that's one of the ways that can occur. So cats and dogs usually have different reasons for pancreatitis to develop. In dogs, it can be ingestion of a high fatty meal. That's kind of your classic way that we think of pancreatitis occurring. And thus, we tie it back to Thanksgiving. So while it is okay for your dog to have some table scraps, you definitely don't want them to have a lot of bacon. You don't want them to have all the grease from the turkey itself. You just want to kind of limit what they are given. And if your dog has a really quote unquote sensitive stomach, you really need to be careful what you give them, because the last thing I want is, on Black Friday, you guys have to come into the clinic, though I'm happy to see you because I'll be there, but you guys have to come into the clinic because your dog's having vomiting, diarrhea, or a few days later, your dog develops pancreatitis because of what they ate. So in dogs, the most common causes of pancreatitis include, like I said, ingestion of a high-fat meal. There are certain medications that can cause pancreatitis, and included among those are an immunosuppressive agent called azathioprine. There's certain, we don't use them really anymore in flea and tick preventatives, but organophosphates, which are a pesticide toxin. L-asparginase, we talked about azathioprine, sulfonamides, which in theory, any sort of sulfa drug itself could cause pancreatitis. Potassium bromide, which is a seizure medication, phenobarbital, which is another seizure medication, and high supplementation of zinc, in theory, could do it. The reflux of acid from the small intestine into the pancreas is another way, which we talked about. Okay, so that's the same thing as those enzymes that are supposed to be digesting food and enzymes that are supposed to be activating pancreatic enzymes go back up into the pancreas. That can potentially cause pancreatitis. Being a schnauzer can cause pancreatitis. Unfortunately, those guys are prone to pancreatitis. And in part, we think that schnauzers are known to have high triglyceride levels. And in dogs, we generally don't worry about triglycerides in the same sense, or cholesterol in the same sense as we do in people, because dogs, as a general rule, do not get arteriosclerosis or heart attacks because they don't get like the same cholesterol plaques that people do. But schnauzers are one of the exceptions, and that they, for some reason, in certain instances, can have a higher baseline triglyceride level, and that can contribute to the development of pancreatitis, which just kind of fits with the idea of, eating a high-fat meal. So it's almost like they're always eating a high-fat meal because they have all those triglycerides floating around in their system. And having high calcium levels, which there's a bunch of different reasons. Dogs, and primarily sometimes cats, can have high calcium levels. That can potentially contribute to it. A tumor within the pancreas can cause pancreatitis. Surgery, so anytime you have abdominal surgery, if they manipulate the pancreas too much, or if they need to obtain a biopsy of the pancreas, that can actually potentially cause pancreatitis. So if you have an animal that you take to surgery because you think that there is an obstruction, right? So they've eaten something, it cannot pass, and you manipulate the pancreas too much, or while you're in there, the pancreas looks inflamed and you try and take a biopsy of it, that in turn can cause pancreatitis. There are a lot of items that are up for debate in veterinary medicine, but how much to do to the pancreas when you're in there for abdominal surgery is one of them. But what's interesting is when I was an intern, we had, I can remember probably at least 4 cases where they would come into the emergency clinic, and it was usually cats, for fever, vomiting, rarely diarrhea, and usually not eating. And we would take x-rays and they would look suspicious for a foreign body. And if we had the availability, we would do an ultrasound. But if we didn't, then we would potentially do an exploratory surgery. And in those 4 cases that I can remember, we opened up the cat, and mind you, I was an intern, so I was just assisting. But we take the cat to surgery, we open the abdomen, and we do not find an obstruction. But what we find is a severely inflamed pancreas. And if you're going to go through the trouble of opening an abdomen because you think that there is an obstruction, and if you don't find anything, you should at least take biopsy samples, so like little pieces of the small intestine, potentially pieces of the liver, potentially pieces of the pancreas, depending on how saucy you're feeling, just so you can at least ideally get a diagnosis. But the actual act of just opening the abdomen and flushing it, so you just, once you open the abdomen, you determine there's no obstruction, ideally you take your biopsy samples, then you just take a bunch of sterile saline and you flush out the abdomen. And we used to call it flushing out the bad juju, but realistically what you're doing is you're diluting out those irritating digestive enzymes, and you're helping to just flush the whole system, because all of that fluid will help reperfuse the body. So even fluid that you use just to flush the abdomen, some of that will get reabsorbed into the body. But also, pancreatitis frequently causes what's called peritonitis, or inflammation of basically the lining of your abdomen. And when the lining of your abdomen, or your peritoneum, is inflamed, it can secrete fluid. So you can get this buildup of fluid in your belly. And it's usually not tons, it's usually just small amounts. But that fluid itself becomes irritating. So again, during surgery, flushing it out, removing that fluid can actually be very therapeutic. Now that we have ultrasound a lot more readily available, and you can do it in the middle of the night, or you can stabilize and not necessarily go to surgery right away. I do not see that happen as often, but we're talking 11, 12 years ago, before ultrasound was as readily available, we did have a few cases that did get much better after just doing what's called an abdominal exploratory. So going back to causes in dogs, we talked about pancreatitis. In cats, honestly, a lot of times we don't know. It can be that whole acid reflux idea, from the small intestine back into the pancreas. It could be bacteria going from the small intestine into the pancreas. Certain infections, so toxoplasmosis, which is it's a protozoal infection. The most common times you hear about toxoplasmosis is the reason that pregnant women are not allowed to scoop the litter box, because cats can have toxoplasmosis that they shed in their feces, and if pregnant women come in contact with it, it can be very damaging to the fetus. But toxoplasmosis is a protozoal infection. It's like halfway between a parasite and a bacteria, and that can potentially cause pancreatitis. You can have pancreatic and liver flukes. Those are another type of parasitic infection. Feline infectious peritonitis, which is a mutated viral infection. Calicivirus. You can also have other potential causes, including the phases of the moon. And I say that half jokingly, but a majority of the time we do not know what causes pancreatitis in animals. And trauma for both cats and dogs can be a potential cause. So hit by car, dogs, especially if they receive blunt force trauma to the abdomen, can later develop pancreatitis. Cats can get this thing called high-rise syndrome, where they're like, the most common example is they're either up on a balcony or on an overlook, and they look down, and it's like they get this like overwhelming urge to jump. And if they jump and they have a blunt force trauma to the abdomen, usually, unfortunately, also it involves the head, but if they have a blunt force trauma to the abdomen, that can also cause pancreatitis later on. And going back to the idea of choroiditis, cats with inflammatory bowel disease frequently can develop pancreatitis as well. And it makes sense. I mean, if you have inflammation in the small intestine, it lives next to and directly communicates with the pancreas. So it understandably follows that, what we call pathophysiology, or the mechanism by which inflammation in one area causes inflammation in the other area. So the next question is, what are the signs associated with pancreatitis? And in dogs, you usually, and you have to divide it into acute versus chronic. Okay, so acute pancreatitis is, bam, it happens right away, they get very sick. Chronic pancreatitis is usually more of like a smoldering pancreatitis, and we don't necessarily always recognize it right away. And acute pancreatitis in dogs, they come in sick. Like they have a fever, they have belly pain, they may be vomiting, they have decreased appetite, they may have diarrhea, they may have elevated white blood cell count. Sometimes they can have changes in their liver values, or they can have an elevation in their bilirubin, which bilirubin in part is what's in